Hello again. Welcome to the Ask Dr. Pane segment. We got a question regarding a vaginoplasty. Somebody went for a consultation and was told that they only need a 2-inch area of the vaginal canal corrected with the vaginal rejuvenation procedure. Is that correct? Well, again, it's hard to say because I wasn't at the consultation, but that is not a typical length that you perform the tightening procedure on. That might be true if only the perineoplasty is going to be done. If the person had an episiotomy or a tear during childbirth and the tissue is now thinned out and attenuated, then some people will get that repaired and you don't need a very long dissection, so to speak, to get that repaired. But in general, if you're doing a real posterior repair, the way it's described, the way everybody does it, you have to open the vaginal floor, stopping a couple of centimeters short of the cervix, and that is going to be longer than 2 inches, in essentially everybody, unless there's some abnormal anatomy going on. So I would say no, that's not typical, but I can't say whether or not that consultation is not valid or not because I don't know really what was being discussed. But if you're talking about a standard posterior repair for vaginal laxity, as opposed to perineal tear or scar revision, then no, you're not going to do just 2 inches. It's going to be a longer depth of procedure. This doesn't change really the recovery or anything about the procedure, but in terms of the area that's going to be addressed at the time of surgery, it needs to be done down the floor of the vaginal canal, getting the muscles and fascia and approximating them correctly. And it takes a little bit more than that. But the area right at the edge needs the strongest support. So often we will do some extra suturing in that region to make sure that the perineal body has been built back up. And that is an important part of the procedure. And that may be what was being discussed here. Again, so overall, that's the basics of how the posterior repair is done for vaginoplasty or vaginal tightening procedures. Again, laser is used sometimes, but that is really more or less just a tool. It's really the actual act of restoring that anatomy that is where the benefits of the procedure are seen. So, hope that covers it, and we will talk to you next time.